Good afternoon, viewers in Ireland, and good evening, viewers in India. As you know, Indian media ensured that COVID awareness messages, important government guidelines, and free consultations with doctors reached everyone in the country during the pandemic. Among them, Doordarshan and All India Radio contributed significantly in delivering the message through prompt coverage, ground reports, and organizing programs on public health. Today, our guest speaker is Mr. Mayank Kumar Agrawal, who will speak on role of India's public service broadcaster during the pandemic under Ireland-India Friendship Lecture Series. Mr. Mayank Agrawal is a senior officer of the Indian Information Service of 1988 batch. He is concurrently holding the positions of CEO Prasar Bharati and Director General Doordarshan and DD News. He has long experience of working in various ministries and departments of the Government of India and media units of Ministry of Information and Broadcasting, including All India Radio, Indian Institute of Mass Communication, Press Information Bureau, National AIDS Control Organization, that is NACO, in Ministry of Health and Family Welfare and UPSC. Over the years, he has specialized in government communication. He has widely traveled and participated in several national and international conferences. He has been part of Prime Minister's media delegations in the past to the USA, Russia, Sri Lanka, Zimbabwe, and Maldives. He has been widely appreciated for his work on prestigious Red Ribbon Express project in 2007 and 2009 for spreading awareness about HIV and AIDS in the country. During his tenure in NACO, he closely worked with UNICEF on production of the television serial Kyunki Jina Isi Ka Naam Hai. In addition, he remained associated with several news documentaries and short films. He has participated and made presentations in the international AIDS conferences at Toronto in 2006, Mexico City in 2008, Vienna 2010, and the International Conference on AIDS in Asia and Pacific, Bali in 2010. He also headed the NACO UNDP project on HIV AIDS mainstreaming. Before I request Mr. Agrawal for his lecture, I request His Excellency Ambassador for his introductory remarks on the occasion. Sir, please.
Ashar, at the outset, I would like to express my very sincere, profound gratitude to my respected friend, Mayank Agrawal ji, for kindly accepting our invitation to deliver this very special lecture. This year happens to be a very special milestone for both India and Ireland. While we are celebrating 75 years of our independence, Ireland is celebrating 100 years of its independence. So as new ambassador of India to Ireland, it's my great privilege to not only retrospect about the past bilateral ties, but also strategize about the next 25 years. And while I'm doing this, I feel so fascinated and so humbled by the profound ties that have existed at the grassroots level between the political leaders and people of our two countries. And what really strikes out is that what really defines the India-Ireland partnership is in the domain of ideas, social and political innovation, and artistic creativity, whether it is concept of home rule, whether it is concept of fighting through unconventional means, the colonial forces, whether we are drafting our constitution and our land leadership provides us practical inputs about functioning of a republican constitution, or the linkage and the support in the art and culture field, inspiration that Tagore and Yeats had on each other, and the historic role played by W.B. Yeats in writing the introduction of Gitanjali and proactively promoting Tagore's Gitanjali in the European literary circles, leading to Nobel Prize to Rabindranath Tagore. So what I'm looking for currently is reviving that old spirit of friendship and camaraderie. And there is definitely need for broader engagement between our two countries. There is need to multiply the linkages and dialogues on different themes between our two countries. so that new ideas are created and new partnerships are forged between the people. And the spirit of India-Ireland Friendship Lecture Series is essentially to trigger new ideas and disseminate the positive success stories and transformational changes which are taking place in India in different fields for the Irish people, and also the remarkable, stunning transformation which is taking place in Ireland in every field. That should be known to wider audience in India. So that is why we are very grateful to Mayank Agrawal ji for sparing time despite his extremely hectic schedule. In the scheme of things, I see a very important role of media in spreading the spirit of friendship and creating new linkages between our two countries. Prasar Bharati, naturally, in the field of media, has the most important, preeminent and pivotal position in India. And as an outsider, I really admire the tremendous role that has been played by our public sector broadcaster. The reach, reaching out to the remotest corner of India and unifying India is a great service that Prasar Bharati, Doordarshan and All India Radio have contributed to. And Doordarshan, under leadership of Mayank ji, has been very innovative in coping with serious emerging challenges. And now I believe that Doordarshan has about 90 different channels, 36 channels on small definition, standard definition, and 3 HD and 51 specialized co-branded educational channels. And Doordarshan programs are enjoying highest gross viewership, unique viewership of about 750 million people. And also the role that has been played by Doordarshan during the Corona pandemic. I was myself in Delhi and have been first-hand witness of the criticality of the situation of Corona pandemic. It was unprecedented in many ways, not only the geographical coverage affecting whole of India and whole of the world, but also how it impinged on every aspect of our life. Whatever we treated as a normal way of living was disrupted and challenged. And that therefore dealing with Corona in a country as big, as complex, as diverse like India really needed a national effort, collective whole of the nation effort, and the kind of mass mobilization that was needed, that would not have been possible without the charismatic personal leadership of Prime Minister Modi, but also the role of public sector broadcaster like Doordarshan. So their role in not only educating the people, guiding the people, but also calming them, entertaining them, keeping them positive and keeping their morale high. The role was very significant, particularly because India is going through a political polarization, and there were attempts in many quarters to sensationalize because of political motivations, and disinformation and misinformation was sought to be disseminated. So role of Doordarshan is becoming, with every passing day, more and more critical for India. And the gold standard that Doordarshan is setting is a role model for the rest of the media. Yat yat acharati shrestha tat tat deve taro janah sa yat pramanam kurute lokas tadanu vartate. So let me invite the leader, the CEO of Prasar Bharati and managing director of Doordarshan, to share his wisdom and inspire us by his thoughts.
Thank you, His Excellency, Mr. Akhilesh Mishra, Indian Ambassador to Ireland, the dignitaries who are present, the listeners who have tuned to this lecture across the world, especially Ireland, India, And I am really thankful and I appreciate His Excellency Mr. Akhilesh Mishra's efforts to organize this Ireland-India Friendship Lecture Series. This is something you are bringing the collective wisdom, particularly the great civilization which India is, the wisdom from the past which India has spread all across the world in the form of this lecture series, which you have encapsulated and you are spreading all across in the world. So thank you, His Excellency Mr. Akhilesh Mishra, once again, and thank you for inviting me for this special series. As you have already said, that media played a very significant role in the current epidemic, particularly in informing people about do's and don'ts and giving them timely information. Because this generation in the world, first time it was facing such type of situation where it was not known what the future is going to be. From the very beginning, when this epidemic, this was about this, the people came to know it was only through the media, and then never thought of it that it will have such a dreadful and difficult aura which around it, which is, I would say, going to be the black aura, and where the humans are in this was very difficult for anyone to imagine. The role of media was very significant from the very beginning, because the first information about the epidemic was given to the world through media. And from the spread, informing the people about the epidemic, its different dimensions, and how to check this epidemic, that was the media played a very important role. I would go to the beginning of the journey. That was about in the year 2020, in the month of March, when first time the lockdown was imposed. And the governments the world over also didn't know what to do at that time. Even in the beginning, there were two views that whether a person should wear mask or should not wear mask. So the new information were emerging. The people were in dark, the governments were in dark, the health system was in dark. But as you say, that always at the end of the tunnel, there is light. So the humans, the governments, the medical fraternity, the world over, I would say they faced this challenge and ultimately emerged victorious. Before I go to the specifics, I would like to share a little bit about India's public service broadcaster, Prasar Bharati. It comprises both Doordarshan and All India Radio. Both have very wide reach, almost reaching to the every nook and corner of the country, to the remotest of the places. Doordarshan has 36 channels. As you rightly said, that it has 51 co-branded educational channels also. But these are the 36 channels in all regional languages. We are reaching out to the people. We have national channels, we have regional channels. All India Radio, it has a wide network of radio stations throughout the country. The reach of radio in terms of spreading any information, in terms of India's number of dialects which are spoken in the country, it is unimaginable. So Both Doordarshan and All India Radio, they swung into action immediately from the very beginning. First was spreading the information about the guidelines and protocols which were coming from the government of India from time to time. Then informing the people what is the right action they have to do, as you know, in the beginning, and which is continuing even till today, which is the, when you say that precaution is the best medicine against any disease. So it is still continuing that wear mask, keep social distancing, and sanitize your hands, wash your hands. So what was in the beginning, that apart from disseminating informations about the guidelines, the protocols, then when the lockdowns were imposed, what should be the public behavior? They have to stay in homes. Only in condition of extreme necessity, they had to go out. Even if they are going to the markets only shops which were supplying essentials were open. But how to purchase even grocery from those shops, stay in the queues. So that all information, it looks very basic today, but that was very important at that time because the people didn't know. And telling people that even if you have caught this virus, then stay calm, stay positive. It is not something that you are going to die. You have to take all precautions. And if there is necessity, then you go to the nearest hospital where COVID or COVID-related treatments that were being provided. Immediately what we did as the public service broadcaster was that we started programs on Doordarshan and All India Radio, in which we called the medical experts from the topmost institutions, medical institutions of the country, which included certainly All India Institute of Medical Sciences, Delhi, RML hospitals, the government experts, and we named this program as called Doctors Speak. And this program became very widely popular. It was the phone-in program where people could ask their questions and answers were provided instantaneously. And this program was conducted not in English or Hindi, in 18 Indian languages. In the beginning, we had this program once every day, but the demand grew so much that we increased the frequency of this program thrice a day. So we had morning, afternoon, and evening. So this was on television, and similarly on All India Radio with the same branding, Doctors Speak, we started program all across the country, giving answers to the people's queries immediately. Second, you know, when people were staying inside home, there were many, they had to stay outside homes. Yeah. So you know about Corona warriors, our doctors, our nurses, and not only doctors and nurses. Even if your sanitation workers, very important. The people, though transport was a skeleton, but essential transport, buses, some metros, that was reduced frequency, but that was still there because you could not completely discontinue the transport also. So media people, because they had to cover and give information. So there was a large category of people, including, you see that in the electricity department, in the water supply department, they had to go to their offices. So we put all these people in the Corona warriors categories. and particularly, I would say the doctors and nurses, because I went to some hospitals as part of Doordarshan. Sometimes I went to with my team that how they are covering. I really admire the courage of these doctors and nurses that despite many of them, some of them losing their lives, they how much they could protect themselves. They were touching these people and not bothering for their own lives. So the second, I would say, we were constantly disseminating stories on corona warriors from the field. Our teams went to the hospitals, our teams went to the streets, our teams interviewed the sanitation workers. That was I would say in big numbers. I should admire sanitation workers, because if sanitation activities are stopped, you just see the garbage, if it spreads all around, it will just multiply the diseases. So these good positive stories that there are people and they were gods, they are gods, I would say. Then one very important thing was at that time, fake news, rumors which were spreading. So we established a fact check unit within Doordarshan, and that fact check unit was checking any videos, information which was misleading, going to the and telling the people what is the truth. For example, I will just, many of you must be knowing that there was in WhatsApp, one information was spreading. What was that? That you put the lemon juice in your nose. If His Excellency, you also know about this, and the virus will be killed. And what happened in the process? Many people burned their nasal tract. So the misinformation that there is no virus like corona, it is all politics across the world, because the vaccine companies, they want to sell their vaccines. So a lot of misinformation was going around in the world, and some self-proclaimed doctors also, fake doctors, I would say, they were involved in this spread of such information, which Doordarshan was checking and telling people, and we had established a fact check unit. And I would say it was not only Doordarshan, the entire media machinery of Government of India, it swung into action. And there is a Press Information Bureau of Government of India that was also very active and informing the press about such type of misinformation in real-time basis. Then there were issues about, because when the misinformation was spreading, a lot of people, they started migrating from the cities to their villages. And that was, it could have become a human tragedy, but the Government of India swung into action. The public broadcaster swung into action. And at that time, many media houses, they were sensationalizing this news that people are migrating out of Delhi, migrating out of Mumbai, they are traveling long distances and all that. Yes, it happened, but we presented the right picture, and within 2-3 days, the situation was controlled. Because while many private media houses try to sensationalize, the public broadcaster is constantly giving the correct information. And those even who had left their homes, the government has established centers on the way to take care of them. So we gave information about that. And the one most important step the government has taken at that time, because the people's incomes, they were nosediving, they were facing hardships, it came up with a unique program, which is Garib Kalyan Anna Yojana. Anyway, I will translate for the English listeners that is the free ration for the poor people, the free ration for poor and needy people. So millions of the people, they were benefited by this scheme. The government of India provided them, and this contributed a lot in stopping the migration. So what we did, we covered the stories from the ground. And I would say my people in this organization were also Corona warriors. I share with you, during that entire Corona period, I never stopped coming to the office. Every Saturday, Sunday I came, though I also caught Corona. And when 15 days I was in bed, so that was the only period I could not come to office. But even then I was monitoring the entire situation from home. A few things I will tell you, that it is not only the challenges which are from outside, the challenges, internal challenges also. Because when so many services were stopped, so many offices were closed, but we could not close our office. People had to come. I had to manage. I had to keep the people's morale high, because they also are human beings. They also have families. Their husbands and wives at homes were discouraging them to go to office. But I admire, I praise my all staff people that none of our channels stopped functioning during the entire Corona period and continued serving the nation. We faced situation, we lost our people in our organization. We organized online counseling for such families. Many of our people's relatives, we lost them. There was a gloomy atmosphere, certainly, but this could not deter their determination. They faced problems within families, but they came to office. We also reduced some certain functions which could be done from home. We allowed that they should be done from home, because in our newsrooms also we reduced the number of people. We constantly, in every shift, after every shift, sanitize the newsrooms. And let me share with you, when the first coronavirus was detected in our newsroom, what had happened? There was panic. And I was facing at that time the transmission disruption situation. We had, other than our main office, we had a studio in a nearby another building also. We decided that overnight we will shift to that studio, which was non-functional. Our engineers, they worked, they made it functional, and in the morning at 6 o'clock, our transmission was resumed for another studio, which the people could not even come to know that we have overnight changed our studio, because on air there was no disruption. So I admire my engineers, I admire my program production people, I admire very much my news people, because they were out in the field every day. They will ring me up. Sir, this is the problem. Sir, my wife had got COVID, but I have decided now, because I cannot help her, so I'm shifting to some other place so that I can come to office. I maintained one thing, that the staff, any of the staff who got COVID, I try to send them the personal messages to keep their spirits high. So now I am coming to the second wave, which was very difficult in India. In the year 21, It started around March end or April, continued till around June. And that was the way when India really faced a very difficult situation. And many people were hospitalized because the oxygen levels in many cases were started depleting. So there was a lot of panic. We stayed calm. We continued in touch with the government agencies, the government of India, the how and where you can get oxygen cylinders, information, real-time information on the availability of hospital beds. Then, if people recall, there is one medicine which was remdesivir that was being sold at very high rate in the black market, and somehow the misinformation was going that it is life-saving drug, though it was not true. So such type of information, right information to the people, supply of oxygen, and that time the government of India ran oxygen express trains, and which carried oxygen supplies from one part to the country's another part. So we constantly gave updated situation on this oxygen express, and under the able leadership of our Honorable Prime Minister of India, we successfully faced that situation and emerged out of the crisis compared to any other country in a much better way. We lost people, but not that many. And then came the vaccination drive. When the government of India that decided that there will be vaccination for all. And when this vaccination started, then also there were a lot of problems faced. There was vaccine hesitancy. There was misinformation spread about this vaccine also. We took the stories of vaccination teams, which went all across the country to difficult areas. Our visuals, they were like they're taking the vaccine in boats. There were vaccine boats because some places there was flood in Bihar and there were vaccine boats. I remember very well one visual. I could not bring it today because I didn't sometime where they had to take the vaccine in Arunachal Pradesh across the river, and this bridge was in a condition that you could not go across. So they made the bridge of ropes, and they crossed to the other side and took the vaccine. So supporting the government of India's efforts in vaccination, that was another challenge, and we took it from the front. Here I would like to share one thing. We enjoy the people's trust. Recently, there were 3 surveys which have been done by Oxford and Reuters. And in those surveys, public service broadcaster Doordarshan and All India Radio, they have stood at the top in public trust compared to any other television or electronic media channels. So that is really the love of the people, the trust of the people we enjoy. A few more things I would like to share with you. The good news stories. You would have heard of good news stories. Yes. Doordarshan is the first channel which started good news stories, not in Corona period, but way back in 2014-15 itself. And we have good news bulletins, half an hour good news bulletins every week, where the good and pioneering work being done by the people across the country, that is being showcased. And I'm happy to share that because of our stories, there are many people who have come to the focus and have also got the awards like Padma Shri and Padma Bhushan in the country. So that is the role we are playing to bring the success stories, the people's unique work, and many people, they are in the their rickshaw puller, tea sellers, they have done such remarkable works which the money cannot do. So that is the good news stories I want to focus. Ground reports, going to the people, collecting reports, and telling the world about the truth. So how the government schemes are working. So that is something we are giving constant feedback. We have our digital outreach, which is also very important. We have Twitter, we have YouTube. So a lot of people are watching us and reaching us through these mediums also. So this is, I go to the another thing, which if you recall, the retelecast of Ramayana. Yeah. So the people were inside their homes, and it was being discussed that what we should do. And the idea came up that why not we telecast Ramayana again? And within 2-3 days, we were able to bring. And I am happy to share with you that this viewership became world record. This was the highest viewed serial at that time. Let me read it out from here. With the rebroadcasts of old iconic serials on DD National and DD Bharati during the lockdown, that included certainly Ramayana, Mahabharata, Shri Krishna, Doordarshan again reinforced its position in the hearts of Indians as the national broadcaster. According to a report by Broadcast Audience Research Council of India, Doordarshan achieved its objective to ensure that people stayed at home. In fact, that was the objective. So because of our serials also, people stayed at home and keep them entertained by broadcasting the old classics. So another thing which was very adversely affected was education at that time. So during the pandemic period, we opened television channel for electronic classes. Those classes were put on YouTube, and almost every state government, they utilized Doordarshan outreach to reach out to the students in different age groups and of different classes and of different subjects. So that was another very great and service which Doordarshan played. And even on All India Radio, there were the lectures which were broadcast, and people very well appreciated all these efforts. In the initial stage, DD channels aired about 2.5 hours of educational content daily, and All India Radio aired about 1.5 hours of educational content daily. And this that was the beginning, and it continued. Some places it was even 5 hours in some states. It depended on the state governments also, that how much educational content we got. Then another thing was, it's the people's not only physical health, the mental health. Staying inside homes, it very adversely affected children, their mental health. We organized programs, shows on mental health during the pandemic, answering the people's questions, and that also were those shows also were taken very well. So I would put in the words of our Honorable Prime Minister, Shri Narendra Modi ji, media has played a praiseworthy role in disseminating information to every nook and cranny of this nation. Network of media is pan-India and is spread across cities and villages. This makes the media all the more significant in fighting this challenge and spreading correct information about it at micro level. His Excellency, Mr. Akhilesh Mishra ji, you know that our motto, Doordarshan, is Satyam Shivam Sundaram. So we stand for truth. and we stood by truth during this entire period of epidemic. The story is very long, and actually this last 2.5 years of journey, it is very difficult to put in 40 minutes, but in nutshell, I have said these things to you. And so we, from informing people, giving them correct information, countering fake news, bringing up programs like Doctors Speak in so many languages and dialects across the country, telling them about availability of hospital beds, telling them, giving them right information, real-time information on availability of oxygens, medicines, do's and don'ts, guidelines, protocols, and stay safe. So, and with all these challenges, our machinery continued working 24/7 all across the country, all 36 channels, all 400 plus all India radio stations without any break. Thank you very much.
There is no question. So thank you, sir, for sharing your experience, in-depth knowledge, and also an analysis, in-depth analysis of a role of India's public service broadcaster during the most difficult period of pandemic in India. Thank you very much.
Sauji, I wish to say something.
Yes, sir.
Please, please.
Yeah. Agrawalji, first of all, we are so grateful to you for sparing time. I know how busy you are, but you spared time, and also you shared your overview about what happened. During the second wave of Corona, I was myself hospitalized, so I can relate to what you said personally. And based on your superlative presentation, I have come up with like a couple of thoughts about how do we leverage your experience in nurturing India-Ireland ties. Like one is your initiative of fact check and dealing with fake news. And this is a really critical issue for India because we are so diverse, so pluralistic, so much of multiplicity, all kinds of plurality that exists in India. But Ireland also is becoming more and more diverse, polarized, and pluralistic. Ireland also has about 20% of its population non-European, non-Irish. So I see this again very interesting theme for us to have a conversation. Like how does Prasar Bharati deal with fact check issues in terms of fake news and misinformation, disinformation? And what kind of technology is being used? How do you deal with? How do you monitor plethora of platforms which are churning out information and disinformation? There is one theme. I think with your guidance, we can develop some program. Secondly,
certainly, yes.
Secondly, we have always admired the role of Doordarshan and All India Radio as platforms for healthy, candid, honest dialogue, not necessarily or even agreeing to the single point of view, but very healthy, mutually respectful conversation, which we don't find in most other media platforms. In India, there is a saying that Satyam bruyat, Priyam bruyat, na bruyat, Satyam apriyam. But today, unfortunately, we see most of the platforms are like verbal stone pelting. They are not respectful, deliberately hurtful. So again, I think this is again a very significant theme for India, Ireland as two vibrant democracies to have a conversation on. Like, how do we nurture that spirit of healthy discussion, healthy debate, which is accommodative of each other's concern and viewpoint of view without feeling vindictive and deliberately hurtful to others. Third is your role of reaching out to different regional linguistic groups. Again, I think Ireland, has two major languages, two official language. One national language is Irish, which is quite similar to, in terms of the predicament that Ireland faces with Irish, it's quite similar to Sanskrit in India.
Okay.
The number of speakers of Irish is about 1% of the population. And like Sanskrit, also in India, we have few number of people who are speaking actually, but it plays a very vital role in our culture, our civilization, our identity. Same is in Ireland. So, again, this is an interesting theme, how a national broadcaster like yours, how is playing a role in nurturing, preserving, and promoting a very, very critical language, a very vital language. So this is again interesting theme I would like to pursue with your colleagues. Third is I was very happy to see the role played by Doordarshan in coping with the Corona period, closure of schools and universities, to education platforms, your content. Again, if you can connect me with the technical people who are actually dealing with the generation of educational content for different levels, different subjects.
Okay.
Again, Ireland is a very vibrant hub of high-end, cutting-edge tertiary as well as pre-university education. So I think this is again very interesting area. Thanks to you, it has come to our notice. We can work together. How do we leverage the online virtual medium for educational content? And also lastly, Ireland has like us, they have dealt with the Corona quite effectively and relatively one of the better performers. But there is a huge issue of dealing with post-Corona mental stress and trauma. And I know that Doordarshan played a key role in bringing kind of a broader holistic approach to dealing with this issue. Not only the modern Western allopathic techniques, but also yoga and Ayurveda.
Yes, yes. That is one very important point you made, yoga and Ayurveda.
Yeah,
and
so you played a very critical role in like creating that holistic package, which is more sustainable, more affordable, and without any side effect. So that is again very interesting area that you have flagged to us, thanks to your presentation.
So, His Excellency,
yes,
certainly we can have more in-depth discussion on that, how we used to do fact check. Yes. Nowadays, there are tools available, even online tools available. So one can use those tools and can do ascertain the truthfulness of any claims which are going spreading. Because there are certain claims on face value you doubt.
Yes.
And then you further do the fact checks. Then educational platform, certainly Doordarshan played very key role in that, and even All India Radio, there were lectures, and those lectures would come to us from the different departments of education in the states. So those they produce in their own studios, and they bring to us those pre-recorded lectures. And you know that those lectures, once you put on YouTube, so its value never dies. It's always there because these are those lectures. So that is another thing. Third, you said about this language. Yes. Irish language, Sanskrit, and because I know your interest, so such deep interest in Sanskrit, really, and you being there now in Europe, you know the linkages which Sanskrit has with the world languages, and this is something remarkable. That is something very dear to my heart also, that you find so much common elements between Sanskrit and European languages. And recently I had met not recently, sometime back, Lithuanian ambassador in India, and he gave me a Lithuania Sanskrit dictionary. Yes. So this becomes something so interesting once you travel to the past thousands of years back. that at that time the people were moving from one place to another place and taking their language, taking the civilization, and it is the India happened to be hub of civilization, and from it is spread to many places. And this is another very interesting topic, though not related to my direct work at present, but something like I keep on studying. So that also certainly we will discuss sometime. Yes.
Thank you, sir. So we end the program now.
Thank you so much.
Thank you so much.
Thank you.
Thanks for inviting me and giving me this opportunity.
Thank you. Very kind. You're most kind. Thank you.